Hello everyone. So we'll continue our cardiovascular discussion, like the most high yield questions that highly will show up on the exam. Okay, so let's go continue another case. Okay, so 56-year-old, okay, woman came in. She had a mitral valve replacement, right? So once you had a mitral valve replacement, you do EF. She has EF of 60%. Okay, status post mitral valve replacement. Okay, and then the question is, what's the best next management or treatment, you know? What's your INR goal? That's what the question is. So it's always can be tricky, right? So what is your goal? Is it 2 to 3 or 2.5 to 3? That's kind of the question. So you want to give Warfarin INR goal 2.5 to 3.5 and no aspirin, okay? That brings us to the discussion. When do you target for this higher INR? If there is a mitral valve replacement, if there is aortic valve replacement with more than one risk factors, if there is aortic valve replacement with old generation valve, then you need to higher, okay? But if there is aortic valve replacement with a newer valve and no risk factors present, then you just do 2 to 3 INR, okay? And what are the risk factors? Risk factor atrial fibrillation, left ventricular systolic dysfunction, prior thromboembolism, prior presence of hypercoagulable state, these kind of the patients. Okay, because why? You want to prevent stroke, right? That's the goal. Because or some vegetations clotting around the mechanical valve. It's pretty risky, right? Risky stuff. When do you add aspirin? Aspirin only if there's a strong indication. Like if there is severe coronary artery disease, you can add aspirin to the warfarin, okay? So that's a question. It's very high yield. It's likely very high yield for clinical practice and could show up on the exam, okay? Let's do another question. Okay, this patient came in, 63-year-old man, just came for routine follow-up. Okay, it's very important to see why they came in, physical exam and test results. That's why others can be a lot of distraction. Story came from Alaska or no Alaskans, unless it's specified. All right, so this patient, he has a calcific aortic stenosis. So they want you to know how to manage it, right? To know how to manage it, they need to give you more information. Okay, there's the information. Gradient is 18. Okay, valve area is 1.6 centimeter. Okay, and there is a 3 to 6 ejection systolic murmur, like as expected. Okay, and then they want you to treat, like, what's best next step management? Do you just treat it with medication? Do you do surgery? Just follow up? What is that? You just, like, for this patient, you do follow up. Nothing now. Nothing now. Now you ask me, why is that? Okay, I'll tell you why. They give you the information. Because the aortic gradient is 18. This is low. If it's less, the cutoff is 20. Okay, if it's 20, this is mild. You just follow up every 3 to 5 years. Okay, and the other thing, you do transvalvular velocity, the other thing, like 2 to 2.9. that is per second, you know, meter per second. That's a lower risk. Okay, now you ask me, what is the moderate? Moderate is like the 20 to 39 millimeter Hg, the gradient. If it's high, this means there's higher flow. This man, you follow up every 1 to 2 years. But what if the gradient more than 40 mmHg in the aortic valve, right? If it's 40, you follow up sooner, like 6 to 12 months. Okay, and then usually this patient, like the transvalvular velocity very high, 4 meter per second or higher. Okay, all right, so now let's go with the next question. So you see a patient who's 48-year-old woman, okay, and she just came in to discuss risk factors. So did she ask you what reduce cardiovascular disease risk? She just asked questions. She just came for the office, gave you money. Just ask for this question. As a physician, you should be able to answer that. Okay. What could improve decrease cardiovascular risk? We discussed the DASH diet to decrease hypertension. There's another one, cardiovascular risk. So you advise the Mediterranean style diet. Okay. What other things that, if you can ask about that, what other things? So what is the Mediterranean diet? Mediterranean diet is increase fruit, vegetables, whole grain, legumes, nuts, olive oil, poultry, fish. You increase intake of those things. And you decrease the red meat, salt, saturated fat, and that you want to decrease the salt, saturated fat, salt, and red meat. Okay, this is the Mediterranean diet. What is the DASH diet? DASH diet, you increase fruit, vegetables, whole grain, low fat dairy, nuts, fish, poultry. It's kind of the same, and you decrease red meat, fats, and sweets. And sodium intake less than 2300 milligram per day. Okay. And other things, smoking, alcohol cessation is good. If you exercise, also good. Strength training twice a week is very important. And then you want to do 150 minutes per week moderate aerobic exercise or 75 minutes per week vigorous exercise. So you choose. If you want to do moderate, you got to do more. If you do vigorous exercise, you do 75 minutes, you're good to go. So if you want to save time, do vigorous exercise. So these are the things to, so this is because it's important. Very cardiovascular is #1 killer in the US. So they ask you about it. Okay, you got to know what decreases risk. All right, so now we get this kind of a question. Okay. This is another case. Okay, 45-year-old man came and has pancreatic lesion, right? So he has pancreatic lesion, EF 60%, and on warfarin for mechanical valve. And what best next step? They ask you, okay, do you stop the warfarin or you keep it going? That's the question. So in this situation, what you would do, you would stop warfarin and proceed with biopsy when INR less than 1.5. Okay, when the INR less than 1.5, that's when you do the biopsy. So okay, that brings us to the discussion. Okay, what are the very high risk conditions that you want to hold the high risk conditions, and what are the pre-operative thrombotic risk? What increased risk for pre-op thrombosis? There are very high risk conditions and there are high risk conditions. The very high risk conditions, three things: valvular disorders, mechanical mitral valve, cage ball or tilt disc mechanical mitral valve. That's one thing. If there is venous thromboemboli, like in the past 3 months, or severe thrombophilia, like protein C deficiency or so. If there is atrial fibrillation with CHA2DS2-VASc more than 6, or atrial fibrillation with stroke in the past 3 months, or there is rheumatic valvular disease, these are very high risk conditions. These are three things: valve, venous thromboemboli, atrial fibrillation. What are the high risk conditions, like a little bit lower? For valve wise, patient with bileaflet mechanical aortic valve, more than one risk factor, hypertension, diabetic. If there is a venous thromboemboli within 1 year, but more than 3 months. If there's active malignancy in the past 6 months as well. If there's atrial fibrillation with CHA2DS2-VASc 4 to 5, also high risk, okay? So these situations considered with high risk. So patients with high risk cardiac conditions for pre-op thrombosis managed with warfarin, is recommended that warfarin is held until the INR is 1.5, then the surgery may be performed. Okay, the surgery. Now, when do you do bridging, when do you not? So if there is very high risk conditions like mechanical mitral valve, then you want to do pre-op bridging with low molecular weight or unfractionated heparin, and then you stop it before the surgery, do surgery, and there's warfarin afterward. This is very important as an internist. You get that a lot, So you want to know, if you're not sure about the situation, just bridge, if you're not sure about what's causing the situation, if it's like there is like a high risk thrombosis, mechanical mitral valve, thromboemboli, atrial fibrillation with high risk, bridge. because there's risk for all of these things, you know. So this is what warfarin. Okay, another question about warfarin. Okay, 78-year-old woman need cataract surgery. Okay. Okay, she's also of course has warfarin, take warfarin, and INR is 2.5. Okay, and they ask you, okay, what to do? You're the doctor, tell me what to do. So this one, continue warfarin, and no change in dosing, because if you can't get a haircut, you can get a cataract surgery. Okay. So the one that has pre-op bleeding risk, like if there is high-risk surgeries like intra-abdominal biopsy, like this patient in the previous question, you want to hold warfarin. If there's high risk, you bridge. If no risk, you don't bridge, and then resume it after. If there is cardiovascular, neurosurgical surgeries, if there's intra-abdominal urologic, like TURP procedures, transurethral prostate resection, joint replacement, laminectomy, renal biopsy, endoscopy with FNA. These are high-risk surgeries, right? So you want to hold the warfarin, bridge, and then resume. But if there's low-risk surgery like cataract, CVL remover, pacemaker, lymph node biopsy, endoscopy with needle biopsy, without needle biopsy, carpal tunnel repair, these are low risk. Okay, so nothing do need to do about it. Just watch it. All right, another interesting case. Okay. You see 76-year-old woman, okay, come in with dizziness, palpitations, okay, EF 65%, right? So EF is 65%, dizziness, palpitations. What would you, when they're asking, and found AFib, they're asking what is side effects of antiarrhythmic if you start them on these patients. Use a higher risk of med toxicity. So their question basically, if you can do a rate control, go with rate control. You do rhythm control only in certain situations. And if you want to do rhythms control, if there's patients completely healthy, you do flecainide. If they have hypertrophy, you do amiodarone. If there's coronary artery disease, you do sotalol. If there is heart failure, you do amiodarone as well. If there's hypertrophy, heart failure, amiodarone. If it's refractory to all of that, you can do ablation as well. It can be helpful, okay? Alright, so this kind of the other case scenarios, okay? This is important about warfarin. This is kind of high yield, interesting, good topic, okay? Now we're gonna move on to the next section.